We're talking to essential workers on the front lines, plus a Capitol Hill update from Congresswoman Dita Titus. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat, Cashman Equipment, and additional supporting sponsors.
When Nevada shut down almost 2 months ago, an unlikely group of workers took to the front lines. Grocery store employees became essential workers overnight, protecting store patrons by cleaning carts and ensuring social distancing in stores. Transit workers also found themselves at the forefront of the pandemic, ensuring all riders can travel safely during this unprecedented time. Hospital staff, including doctors, nurses, and countless unseen healthcare workers, have been working tirelessly for months to provide comfort and care during COVID. These are just a handful of examples of essential workers risking their health to keep our state running safely. Today, we thank them for their efforts. To get a glimpse of what it's like on the front lines of this pandemic, we are joined by Aubriana Martindale, Division Corporate Affairs Manager for Smiths, Dr. Jeffrey Murawski, Chief Medical Officer for Sunrise Hospital and Sunrise Children's Hospital, and Cesar Mendoza, Public Transit Bus Operator for MV Transit. Well, thank you so much for being here, spending the time to talk with us, but also, and more importantly, we wanted to thank you for just the time, the empathy, the patience, the sacrifices, the hardships that you have gone through and will continue to go through. Simply put, for us, for our safety, for our health, for our security, we can't be more thankful, but we want to try to be as thankful as we can. And thank you so much for everything that you've done. Both you and, of course, all of your colleagues and workers like you that have been on the front lines. We really appreciate it. And Aubriana, I wanted to start with you and talk more specifically about the supermarkets in this. Many of us, the assuring safety and supply at our local supermarket is an unmeasurable comfort here. And I wanted to know just what has been the response you have received from your customers and the community at large, really, on what supermarkets have risen to right now.
Sure. Well, thank you for that acknowledgement, especially for our grocery workers. You know, when you think of a crisis and you think of frontline workers, you think of first responders, you think of the doctors, you think of the nurses, but you don't always think of grocery workers. But after your health and well-being, food is essential, right? And so our associates have been instrumental in making sure that our stores are open, that they're clean, and that they're stocked. You know that we've seen a lot of traffic in our stores, and the best way for me to explain that is we're seeing people in our stores in the amount that we usually see the day before Thanksgiving. Now, in a grocery store, we can usually anticipate that need, right? We couldn't have anticipated a pandemic. So we make sure we have an emergency task force in place. It's an evolving situation. We're realizing what the new norm is here, but certainly it wouldn't be possible without all of our grocery store associates who are in there every single day, making sure that everybody has fresh, affordable food.
And Jeff, as Aubriana mentioned, we're not thinking of the supermarket workers. We are thinking of the health workers here as being on the front lines. But then there's things that hospitals are doing, and I want to bring attention to the discharge ceremonies that you've been practicing here. At least last week, 80 plus have recovered and gone through a discharge ceremony at your hospital. Of course, these are patients that have recovered, and just has that taken on even more importance with the specific challenges of COVID-19?
Well, I think the discharge ceremonies are really important, and we're just about to hit 100. So, we're really looking forward to that one. And I think they mean something to us because people think about this disease and, unfortunately, the sad side of folks that pass away, that don't beat the virus. And we want to celebrate all those instances where folks do beat it. They go home, they're getting better. They're going to rejoin society and they're going to have a wonderful life and fully recover. And that's what we hope for. We want to see every day because that helps to recharge us to go back to the front lines. For our nurses who just finished Nurses Week, who do that daily care every day, for our doctors that get in there and do the diagnosis and treatment. It's just nice to see it.
And to bring attention also to our family members here, of course, because of the disease, at least what the media is portraying the situation to be, is that family members don't necessarily have the close contact they would when you have an individual, family member, a loved one that is in an ICU type situation. Do these celebrations then, are they a way of bringing the family, but also the community more into what is the successes that a hospital like yours is having?
Well, I think it's a great way to share that with our community that, good things happen and families can engage. And we do everything we can with virtual visits to still engage families in care. It's just, unfortunately, we want to keep our patients and our health workers safe. So we have to have the visitor restrictions that we have. And especially for those patients with the disease, we don't want to expose others to it without the appropriate protection. And you have to be trained to do that well. So those things really help us. But again, I think they do mean a lot. To do that. And other things mean a lot, like the Thunderbird flyover meant a lot to us. Chalk art on our sidewalks that speak to the healthcare workers mean a lot. And, my staff say the same thing. They thank the grocery store workers and the other people that they work with because they keep them fed so they can go to work, so they can get on the bus and get to our hospital and do what they need to do. So, we're thankful for all the other people who are essential that get us the things we need, the truck drivers and everybody else. Because without supplies, we don't function either.
Right. And we're talking about the successes. As you mentioned, we do not want to forget that we have lost over 330 Nevadans at time of recording here. We had a viewer that brought up the difficult role of last responders in this. We're talking about first responders, but last responders being the coroners and the funeral home operators and their staff as well, and morticians, and what their role is here. Can you give us some insight, Jeff, on how important that is to this entire process as well?
I mean, they play a critical role every day in what we do, but it's very important to recognize that they have to have new policies, new procedures, new processes to unfortunately deal with loved ones who've passed, to help the transition, to manage the load. And thank goodness we haven't seen what New York has seen in terms of the number of deaths and completely overwhelming the system. We've had great partnerships with our funeral homes and the coroner's office in being able to address these issues. And they've given us good guidance on how to minimize their risk too.
Cesar, another very vital piece of this, of course, is transit, getting individuals to some of these essential frontline places we're talking about, like our healthcare facilities and our supermarkets. On your bus routes, where are most people going, first off?
A lot of people that be catching the transportation on our coaches are essentially going to essential places like hospitals, or they're essential workers like nurses and grocery workers and security guards. All these people that are getting on the buses are also going to doctor's appointments.
I know that the buses are configured now, and as Aubriana mentioned, a lot of safety measures have been put in place. RTC also has a task force and has instituted all social distancing measures. Of course, all passengers are entering the bus in the back. I'm wondering, does that separate you from your passengers, or are your passengers still able to share kind of their feelings and kind of what they're going through and still have the normal conversation that they would with you?
Yes, I've had several conversations with coworkers and passengers alike. And I shared my anxieties and my concerns about this COVID virus.
Well, Cesar, I have a question for you. We talk about social distancing as such a big part of this. Your passengers, I mean, how well have they followed what our social distancing measures have been and what RTC is trying to do?
They've been following it pretty well. And most people that gets on my coach are very appreciative and thoughtful, that and they thank us all the time that we come around and taking them to essential places. I keep my bus very clean, and I ensure that the passengers are comfortable, and they always thank me, and they really do. They wear masks, and just like our company and RTC have provided us PPE. I also bring PPE, extra PPE with me. So if I see a passenger that doesn't have any PPE, I provide that for them.
Yeah, Cesar, you've touched on a very important piece of this. Aubriana, I want to go to you and ask a similar question here. That what you provide customers is so important here. And I notice at the supermarkets, of course, we have all these new restrictions, one-way aisles, social distancing when you're in line, of course, the plexiglass coverings, and yet the workers in the supermarkets have not changed. I mean, they still greet you with a smile, if they can, at least with their eyes. And, that has been a big piece of that. And I'm wondering, is that just the good-natured supermarket staff that we have, or is that part of also the strategy that's been employed here to make sure that business as usual is happening in supermarkets?
Sure. So thank you for recognizing that. Our associates are certainly extraordinary in making sure they provide friendly service to our customers. But when you think about it, many of us took advantage of the small interactions that you were able to have with your neighbors or your coworkers. And at this point in time, some people are only getting their interaction at the grocery store. It's one of the only essential businesses open. And so we want to make sure that our customers, when they walk through that door, they're feeling comfortable, they're feeling safe, they're getting what they need. And of course, that our associates welcome them with that hospitality of that friendly smile.
Great point. Jeff, I want to talk about hospital staff here. You confront life and death situations every single day. That hasn't changed, but there are new challenges with COVID-19. How has your response been different? And how are your colleagues and you yourself dealing with some of the differences and changes when we're confronting something like COVID-19?
I think the first thing for our staff is making sure safety's first. We want to get them the right PPE, and with a new virus that evolves a little bit on what the right PPE is and continues to be. So that's our first thing, is making sure everyone feels safe and comfortable. And that's been a challenge that we worked really hard to make sure we've met every time. Finding the new normal is different. Universal masking in a hospital where everyone wears masks. I have mine all the time. So I have no one around me for 6 feet right now, which means I'm safe. But in the hospital, when I'm out, I'm wearing a mask, no matter where I am. All of our staff are, all of our patients are. Those are things we have to adapt to, and we're going to have to change to get through this. The emotional stress is different. We don't have the social events that we used to have. We don't do the things we used to do. There's nothing I liked better than going grocery shopping, honestly. That was one of the things that relaxed me from my job. I have not been to the grocery store since this started. I have curbside delivery. And don't have those interactions. So we're all having to kind of find those in our workplace as essential workers because they're just not there in our social interactions.
And you mentioned a higher level of stress. Cesar, I want to talk a little bit about something we do not want to forget about, that frontline workers across the board are not only more at risk for contracting the virus themselves, but that the loved ones they have at home are also more at risk, especially if you have a family member that is vulnerable. And Cesar, your wife is considered one of the vulnerable populations here. I wanted to ask you, what's it been like confronting that reality day in and day out, that not only you could potentially be at a higher risk of contracting it, but that your loved ones could be as well?
Yes, I was very nervous at first when I first found out about the COVID-19. I was very nervous about the outcome and if I would have contracted the virus. And knowing that my wife was very high risk, I took certain precautions. I changed my whole daily routine. It's been hard because since she's very high risk, there was times where I slept in the other room because I was so afraid of, transmitting the virus to her.
Yeah, Jeff, Cesar brings up a great point. Of course, we've seen in the media, especially healthcare workers sleeping in their garages, staying away from their family. You've mentioned the social impacts at work, not being able to socialize with your colleagues in the same way. How about family life here? What are you missing, and what is the impact, not only your colleagues, but your family members, and as you mentioned, even your daily routine of not going to the market?
Yeah, I mean, so for me, it's been really interesting. I have my wife and who's high risk, and so I'm very careful about what I do and trying the right things. My dad is getting chemotherapy right now, and so he's a high risk individual, and he's in town. I haven't seen him since this started, other than FaceTime. My kids are in college, and I didn't bring them home, so I haven't seen them for 6 months. I really haven't seen anyone but my wife since this started when I'm in my social world, other than FaceTime, which has been, and virtual intermeetings, which have been a great thing. I have calls with friends that we have regularly set up to have those social interactions. And then at work, we try to make some space with appropriate masking to have a couple of minutes to recharge and to do what we need to do to get through. Because we have to find the new normal. We can't stay this isolated for forever. We have to figure out what that's going to be as the conditions in the community change.
Aubriana, social distancing, lack of PPE, these are things that have been in the media, things of why supermarkets and really all our frontline workers have had to change their protocols, as Jeff mentioned. I wanted to know, and I just want to bring one up that's in the news right now, is we have a much larger low-income and Hispanic population that seems to be contracting COVID here. I'm wondering what kind of extraordinary measures are supermarkets taking then, maybe to localize supermarkets that are in predominantly low-income or Hispanic neighborhoods to make sure that they are equally or more so safe?
Sure. So the health and well-being of our associates and customers is our number one priority since this has started. And like I said, it's been evolving. And so we've been looking at everything we possibly can and implementing things as quickly as possible to not only protect certain areas, but protect all of our customers. We have 141 stores across 7 Western states, just the Smiths division. We employ 20,000 associates. We have thousands of customers who come into our stores every day. So we have to make sure that their safety is a priority. And there's been several things that we've done. You mentioned social distancing. We've now implemented one-way aisles. So when you're in the grocery store, you don't have that side-by-side interaction. We have the shield guards at the cash registers, and that makes it so it eliminates that interaction between the customer and our cashiers. You'll notice all of our associates now wear masks. We did have to call on government officials. PPE has been a difficult thing to secure, but with their help, we've been able to secure those and ensure that our associates have that PPE and they're able and safe to come to work. Now, we do need to ask that our customers also wear that PPE, and that's something we need help from the community as well, and from government officials, is making sure that that PPE comes available to the community, especially those at higher risk.
Jeff, Aubriana brings up some great points there. These are things that are being implemented and probably will not change for quite some time. As you also mentioned, we have to kind of find a new normal here. Until a vaccine is discovered and distributed, of course, we are going to still be implementing a lot of these same practices, but we are also now moving towards reopening phases. When you're looking at just a public health perspective here, what do you think is going to change and what is not in some of our workplaces here?
I think what we're seeing in universal masking and social distancing, those things are going to become normalized. Things we need to do to protect others. Social distancing and masking are really about us as individuals choosing to protect others from ourselves. And that's a giving moment, and we all have that opportunity to give. And I think we'll see those things continue. I think we'll find ways to interact and bring folks together. I think we'll have to adapt to more hand washing. I think everyone's life will get a little more like mine, where I get used to washing my hands and have for a long time, all the time. I think you'll see that change in what people need to do. And I think people will need to be a little more mindful about going out when they are sick. I think we really need to change our culture around, if I don't feel well, it's time for me to stay home with my core interacted people and wait it out and see what happens.
We're out of time, but thank you so much, all of you, for joining us. We really appreciate it. Thank you. We just heard from essential workers on the front lines of this crisis. Congresswoman Dita Titus has been working hard on Capitol Hill to ensure Nevadans receive the support they need. We sat down with her to discuss the latest congressional efforts, including the newest relief, the HEROES Act. Congresswoman Titus, thank you so much for being with us again. It's always great to have you on the show. Yes, thank you for your time, especially how busy you must be right now.
Well, thank you for having me and for all you're doing, putting out good information for the public. That's very important during these times.
Thank you. Thank you so much. As a matter of fact, the show we had last week, we did have some of our city and our county leaders on. We did talk about federal relief. We did talk about some of the pinches and some of the strategies that they are looking at. Of course, on a larger scale, states, cities, and tribal government have been asking for more relief. The House Dems have answered with that with a $3 trillion package. The House Act, which is the Health Economic Recovery Omnibus Emergency Solutions, that's a mouthful. There's also tons in this package as well. Most specifically, and the flagship is $1 trillion for local governments. House Senate GOP has already shown some hesitation and dismissed the bill. There's even some Democrats that are saying maybe let's pump the brakes a little bit and wait. Where do you think we are on this? Your assessment, are we going to get towards a vote anytime soon on this bill?
Well, I'm going back to Washington this afternoon, and we will vote. It may be a party line vote. You know, McConnell said initially just let the states go bankrupt. He's already backing away from that and saying there'll probably be aid for state and local governments. And the support for it is bipartisan. Governors from both parties are saying we need this help. And we certainly need it in Nevada when the economy goes down, we go down faster and harder. And that was the case in the recession and now because we're so dependent on tourism.
Let's talk then about where this bill then goes. If it isn't successful, you're saying that the House will vote on it. When it gets to Senate, if it's not successful, there's been talk of a Senate bill. Are we looking at maybe a stripped away version here?
Well, there'll be some things that we bargain on, but I think it's important that the Democrats in the House put this out first because it shows that we really care about our workers, those people who are on the front lines. There's money in there for hazardous pay. That money that goes to state and local governments then goes to pay the salary of those frontline people, whether it's teachers or firefighters. So I think that there may be some bargaining, but we're not going to chip away at it too much. Now is the time to go big. Even from the Federal Reserve, they say money is cheaper now than it's ever going to be. So it's time for investment.
Absolutely. The Federal Reserve has said that. The other thing the Federal Reserve has said is that there's still so much uncertainty in what is going to happen. That's something that's been reflected. The GOP as well. They've said that their strategy is more wait and see. There's too much uncertainty. They want to see what happens when states reopen. House Speaker Pelosi has said, quote, not acting is the most expensive course. Do you agree with that? If we do not act right away, are we looking at potentially expanding what our expenses are going to be on the back end long term?
I believe so because we don't know what's going to happen. And as you have heard, Dr. Fauci and all the medical experts say, if you open up too fast, too soon, too drastically, we could see another spike in cases. And if you do that, then the recovery will take longer and be harder. And that will certainly be the case in Nevada because we want people to feel good about coming back to Las Vegas. But if there's another spike, that's not going to happen until further down the road.
The Review Journal has reported, based on the calculations using census data, that the $1 trillion in relief, if it were to go through, the cities and counties would receive about $1.76 billion. Clark County has already come forward and said that they're going to be over $1 billion of lost revenue in the next 12 to 18 months alone. There was some concern in the CARES relief that's already come through that it is not necessarily for lost revenue, it's more for relief. In the HEROES Act, if that money goes through, is it going to be used any way that a county or a city wants to, and it could be used for loss of revenue?
Yes. In fact, the CARES bill was more for immediate relief. The HEROES Act is more for sustained recovery. And so that money will come back, some directly to the states, some to larger cities. And in this bill, something that's new is a pot of money that will go to our smaller communities. They were kind of left out last time, but they certainly have needs.
We have talked about this on several shows now, that crisis brings new opportunities, opportunities for new growth, opportunities to diversify not only an economy, but potentially bring in new policy and new reform. Do you think we are going to see New Deal style packages here? Are we going to see some sweeping policy reform that we saw during the Depression, or even some of the huge infrastructure projects we had, in maybe a new form of that in things like IT and transportation?
Well, I certainly think so. We've seen what a great need there is for broadband across rural Nevada and around the country. You can't do telemedicine in a time like this. You certainly need that. We've seen that the virus strikes certain communities more than others. That's a real wake-up call to say you need health care for everybody, and we need to look at those injustices that still exist within our social system. And I believe the investment in infrastructure is the best way to get people back to work, get products back to market, and to invest like Eisenhower did with the interstate highway system.
Congresswoman Titus, our show this week is on frontline workers. We're focusing on the essential workers, not only in our healthcare, but also in transit and also in our supermarkets and all of our frontline aspects here. I wanted to ask you, what stands out to you when you reflect on the men and women who have been on the front lines over the last several months here in Nevada?
Well, I am humbled by their courage. They get up and go to work every day under the worst of circumstances. Other people are hunkered down. They are more protected, but these people are dealing with where the virus is, if it's in a hospital room, or they don't know who's been exposed if they're out there in the community. They're putting groceries on our shelves so we can be hunkered down. They are just so courageous, and we owe a great debt to them, but we have to do more than just say thank you. We've got to reward them in some way, and that's in the HEROES Act, a large chunk of money to go towards hazardous pay, because they are warriors. They are on the front lines.
Congresswoman Titus, always a pleasure. Thank you so much for your time. We always appreciate it.
Thank you for having me.
Thank you for watching this edition of Nevada Week. For any of the resources discussed on our show, please visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week. Stay healthy, stay safe, and stay strong.